It's a particularly nerve-wracking time to be a parent. It seems like no matter what we do to keep our children healthy, we're still entering a lottery of diseases and behavioral disorders that are becoming more and more prevalent. With every new study, we're reminded that the incidence of things like ADHD, autism, learning disabilities, anxiety, depression, epilepsy, bipolar disorder, and Tourette syndrome are through the roof. Over the last decade in the United States, the number of children aged 3 to 17 with these developmental disabilities increased by double digits. 11% of children in the U.S., 6.4 million kids, carry a diagnosis of ADHD, with the number increasing by 5% each year from 2003 to 2011. Autism has increased nearly 80%. During this same period, the number of children medicated with stimulants or antipsychotics has more than tripled. A recent study showed that 1 out of every 5 children has been diagnosed with a mental illness. I care about these issues because I'm a mom, but I also care about them because I'm a pediatric neurologist. I'm one of the many people on the front lines of this epidemic every day, along with other healthcare professionals, therapists, teachers, and parents, working to help these struggling children and families. One question I'm often asked is why? Why did this happen to my child? These disorders are obviously complex and can't be necessarily explained by one factor alone, but sometimes we develop insight into contributing factors. Over the last several years, scientific studies repeatedly have found a strong association between in utero cell phone exposure and behavioral and attentional issues in childhood. For instance, the 2010 Danish Health Study evaluated pre- and postnatal cell phone exposure in nearly 30,000 children. Those exposed both before and after birth were 50% more likely to display behavior problems than children with no exposure. Children exposed to cell phones in the womb but not after they were born showed a 40% higher risk of borderline behavior problems. And those not exposed to cell phones before birth but who were using them by age 7 were 20% more likely to have behavior problems. This study was large and therefore statistically powerful, and was also rigorous in ruling out other confounding factors that may have explained these differences. It also confirmed similar findings from earlier studies, and as we're seeing today, disturbing scientific data continues to be revealed regarding the effects of cell phone radiation on developing brains. As a physician, I have to evaluate information about various risks every day. I have to ask myself, do these studies make sense? Is this exaggeration or is it legitimate? And what advice do I offer the families in my practice? Well, each day of pregnancy, a complex symphony of cells in the fetus are growing, migrating, and connecting to one another to become a functioning brain and nervous system. By week 6 of pregnancy, the forebrain forms, and there is already evidence of brainwave activity. The neural tube that connects the brain to the spinal cord closes at this time. By week 17, the brain's left and right hemispheres are developing, and by week 19, millions of neurons are developing. By week 23, the neurons begin to rapidly connect to one another to form a system of communication. This rapid development and growth continues all the way through birth and beyond. When the nervous system is developing so quickly, it also is more vulnerable to interruptions that can disrupt cell growth and connectivity. We know that exposures that occur during pregnancy can have lifelong impact due to these window periods of vulnerability that occur as the brain grows and develops. Wireless radiation is an exposure that has been shown to negatively affect developing brain cells. And children, due to thinner skulls, smaller brains with more liquid cushioning them, softer brain tissue, and a higher number of rapidly dividing cells, are also more susceptible to damage from cell phone exposure than adults. Certainly, babies in the womb, who are perhaps the most vulnerable population of all, seem to be at the greatest risk from all such exposures. What then is my professional conclusion? Though brain development is a complex process that can be influenced by many different factors, growing scientific evidence indicates that in utero cell phone exposure can cause harm. More and more data supports this conclusion that the harm may well contribute to neurobehavioral disorders of childhood. In such a situation, I believe that parents and future parents have a right to be made aware that there are risks from this common and widespread exposure. I will say it again, parents and parents-to-be have a right to know so that they can take steps to protect their children. The precautionary principle, which we've already heard about, holds that when significant risks to public health are suspected, efforts should be made to reduce those risks when possible, even when full scientific understanding is incomplete. Given the number of children suffering from behavioral and attentional disorders, I advise that pregnant women and parents take preventive measures when using cell phones. This means when a pregnant woman or her partner uses a phone, keep it away from her belly and ideally her body. Don't put phones in your pocket while they're on. Minimize exposure in your home by turning off the phone and the Wi-Fi at night and other times that it's not needed. In this case, less is more. Let's work together, doctors, scientists, parents, and industry, to protect the brains of our children. Thank you.